we are charting unprecedented course with the current health crisis, and we want you all to know that we are here for you, and that we will all get through this together. So along with this presentation, we wanted to let you know that we do have an entire page at Missouri Enterprise specifically geared towards helping manufacturers navigate some of the challenges that we face at hand. That site is kept up to date with information on resources, programs, relevant news from the state and federal government, information about grants and funding, workforce assistance, and more. As the state's MEP center, our entire purpose is to help sustain manufacturing in Missouri, bottom line. That mission is especially important today, and I cannot stress this enough, but if your company is in need of materials, supplies, workers, connecting with another state or federal agency, we are here to serve you. As a reminder, we have plenty of time for question and answer at the end of the session. Just simply type your question into that chat, which you'll see here. And without further ado, I would like to kick it off to April Schmidt, who will be joining us from her home in Columbia, Missouri, to discuss infectious disease planning. So April, I'll turn it over to you. And I'm going to mute my computer.
All right. Hello, everybody. And I'm going to say I may end up being one of those dog offenders because I do have dogs, and sometimes there's something or someone that goes by that gets them excited. So I will apologize in advance for that. So one of the things I want to do is to bring up the presentation for you guys so that you have that. There is a chat button or section, so you guys can put your questions there, and we'll try to work through those and answer questions that you have, but we'll also have a question and answer at the end too. I'm really excited to see how many individuals signed up for this, and I'm hoping to be able to answer questions that you have, and that we'll be able to share information with each other, because this is something that's new for everybody. Most of us haven't had to go through this before, right? We've never had a pandemic this big. I think the last one was the flu epidemic in 1918. So we'll start talking about infectious disease planning and response planning and why that's so important. And I put this together from a very broad sense because I know we've got such a dynamic manufacturing environment here in the state of Missouri. And so I'm hoping that content applies to a number of you, but if you have specific questions, you know, like I said, let me know towards the end, or put your questions in that chat, and I'll do my best to try to address those for you. So what is an infectious disease plan? So it's having a plan in place of what you are going to do if you have an employee who becomes infected with COVID, and thinking about it from the sense of what you develop for this COVID-19 response should be a plan that you can enact at some other point in time in regards to if there is some other type of infectious disease that comes up, or hopefully we don't see this resurge, but maybe we do. So it should be a plan that you have in place to address infectious diseases such as COVID-19. So meant to be proactive. And why proactive? Because you want to have it in case you need it. It's going to be really hard to do an infectious disease plan on the fly when you already have somebody at your workplace or work site who's infected. So you want to be able to develop a plan, have it in place, and know what you need to do to protect your employees, your facility, any visitors, vendors, and depending on what it is that you manufacture, it could potentially be your product. All right, so I think about needing to have two response plans. One, what are you going to do if you have an employee who becomes sick and symptomatic at work? And then what are you going to do if you have somebody who's at home but calls in sick, and maybe they were at work just yesterday and now they're symptomatic? All right, and at some point in time, those steps in those two plans will each converge. So it may just be those initial steps in your plan that are different, and then they will end up becoming the same. So one of the things I think is really helpful is to create a flow chart from the steps of showing the steps in the process of what you need to do if somebody becomes infected with COVID-19. So that might be that first step of an employee notifies you and they're at work that they become sick. Who do you want them to notify or tell? All right, and then that same thing, that first step, and if it's somebody who's at home, who are they supposed to notify? then who does that person need to notify? What are those steps in that flow process? I happen to be very visual, so I think about it from the sense of color coding those steps by who is going to be responsible for the information or those particular steps and actions that need to be taken. Once you kind of flow out what that process is going to look like, make sure you trial it. You want to make sure that it's going to be operational when you need it. And when you trial it and do those kind of dry runs, that's going to be what helps you to find and identify if there's any gaps in that plan. Because then once you identify those gaps, you can go back and then you can trial it again to make sure that you've identified the steps that you need to. All right, those once you define those steps, you can identify if there's any particular roles that you want to assign to individuals on your team that need to carry out what your infectious disease plan is going to be and the notifications. And again, at the beginning, I said, you know, this is a plan that you can develop now, but you could use it at another point in time should there be any other kind of infectious disease that may come up. Right. So creating a chart. So you can do that flow chart, and then from there, you can also create a chart that has a listing of people and the responsibilities that that person will need to assume as part of your infectious disease emergency response plan. So you can have a job title, you can have a task that's associated with that. The job titles that go with their infectious disease planning responsibilities, probably not going to match what their job title is for the people that in the daily work that they perform. It's strictly for what that particular plan is going to be. So one of the things I always think about is who's going to be responsible for activating that emergency response plan, who that authority, the authority is going to rest with, and what information does that person need to have in order to know that you need to activate that plan. So it might be that somebody is at work, they're infected, you know, what other information do they need to have, and what are those steps going to be in terms of notifying employees or cleaning. One of the things, there was a really great OSHA planning guide for emergency preparedness, and they talk about in that guide having a space in your place of employment that is kind of a containment room, that if you have an employee who becomes symptomatic at work, that you could move that person to, that would separate them from the rest of the employees until they're able to, and if they need somebody to pick them up, somebody who could then take them home, and then and then you can go through cleaning that space. And then thinking about, again, that that activating that plan, that's going to go back to that flow chart that I talked about creating, and those steps and those decision points that you would have in there about what you need to do. Do you need to initiate a deep cleaning of the entire facility or just a particular workspace? Those are the kinds of things that creating that chart will, and that flow chart will help you with identifying. One of the things I think about is, what number do you want your employees to call if they're sick? Is this the same number that they call right now? Is there a different phone number? Make sure that you're clear to your employees on what information that you need from them. And I put in information you want, but there may be information that you need. You know, if they're running a fever, what it is, what other symptoms they're having, when did the symptoms start, so that you have that information. And again, who is going to be the person who's going to track employee illnesses? It could be somebody in your HR department. If you don't have an HR department, who is that person? And is that person who's going to track employee illnesses going to be the same person that the employees call if they're sick? Are they two different individuals who are going to be tracking that information? Why that information is important is if you have somebody who becomes infected with COVID-19, you're going to need to be able to identify the workspaces that they maybe had been in, employees that they may have come in contact with, and that will help give you an idea of what type of potential cleaning and spaces in your facility that might need to be cleaning or a deep clean in order to maintain a safe workplace for the rest of your employees. Okay. So thinking about that phone tree, right? Make sure that you have a phone tree ready in case you need to communicate with your employees about a closing or a delay and openings so that you can quickly get that information to them, because time is going to be of the utmost importance. If you have somebody who tests positive and you've identified through your emergency response planning that it requires a deep clean of your facility, and that means that you're going to need to shut down operations for 1 or 2 days, you need to be able to make sure you can get that information to your employees quickly, whether it's, and I know I say phone tree, it could be a text tree, it could be an email, however you have decided you're going to be able to, you want to communicate with your employees in case of an emergency, that's the method. So when I say phone tree, it could be email or text tree, however you've set that up. Thinking about, do you have a roster of all your employees available? I say hard copy. Sometimes technology fails us when we need it most. So thinking about, do you have a hard copy of who all of your employees are, and who needs to have a copy of that possibly at home and keeping that information safe, but also who's going to contact who. And that's going to be a part of your infectious disease planning and that flow chart. And if you need to notify employees of a delay in an opening, or that you need to be shut for a couple of days for a deep cleaning, who's going to be responsible for calling what employees? And then you want to make sure that you've not only created that phone tree, that you have tested it. Again, you want to make sure that your phone tree and everything is available, ready, and that you've addressed any potential gaps in communicating with employees, right? And that testing is going to help you find those gaps so that you can fill them in. Something that you want to continue to test on a regular basis to make sure that it's still working, and making sure that you're keeping it up to date, removing employees who may no longer be with your company and adding employees who are new hires. Unfortunately, we are in spring. We know that this is a time where there tends to be some weather disruptions. And you never know when there is going to be some kind of a disruption, whether it's the pandemic that we currently have or something that might be weather related. So this phone tree can serve multiple purposes in terms of business continuity as well as infectious disease planning. Who needs to know if you have somebody test positive for COVID? So making sure that you understand what your reporting requirements are for OSHA or the Department of Public Health. Each manufacturer or business might be a little bit different in who they need to report to. So make sure that you know who you need to report a positive infection to. Also, make sure that you, if you have somebody test positive, you need to make sure that you inform employees in a timely manner, but make sure that your notification does not violate anybody who has become infected, that it maintains their privacy, right? So kind of a fine balance. You need to notify employees that there's somebody who's positive in the facility, but you want to make sure that you're not violating any HIPAA and privacy violations, okay? So thinking about suppliers and vendors, right? Do you know who your suppliers and vendors are if you have to close for a short period of time? If you need to shut down for a deep cleaning, maybe 1 or 2 days, do you know who suppliers and what deliveries you're supposed to be getting? Do you know how to contact them and notify them that you need to possibly delay that? If you have an employee who tests positive, you need to know who also has been in your facility to possibly notify them. I know a lot of companies right now have the vendor and visitor restriction, but if you do still have individuals coming in, you need to still be able to notify them as well. So make sure that you have some type of a sign-in sheet that has their contact information, company, phone number, email, so again, that you can notify them. And again, make sure that you've tested your phone tree. Again, if you must do a deep cleaning of your workplace due to a positive infection, do you know what companies in your area can do that type of cleaning that you're needing? Make sure that you call that company and verify that they can do the cleaning that you might need to have done, and make sure that you have a backup, because they may or may not be available in the time frame that you're wanting them or needing them to clean your facility if you need that done. One of the business decisions that a company needs to make is every time that you have a positive infection, are you going to be doing a deep cleaning? Again, that's going to be each company to make that determination and decision on your own. I have a link in here in case you need to know what the OSHA recording and reporting requirements are. So this presentation will be sent to you so that you can access that at your convenience. So something to think about with your infectious disease preparedness plan is, what is your employees' level of risk? So when we talk about risk and risk exposure, I should say, is individuals are going to have a very high risk job exposure. If very high is going to be healthcare workers, doctors, nurses, dentists, lab staff who are being exposed to individuals who are suspected or confirmed with having COVID-19. High risk are going to be healthcare support workers, medical transport staff who are being exposed to individuals with or suspected of having COVID-19. Medium risk are going to be those that require frequent contact or close contact with individuals who may be infected, or maybe they're not known to be infected at the time. So that's what we're talking about, like schools, high volume retailers, you know, grocery stores, places like that, where individuals are coming in and out quite a bit. Low risk are going to be jobs that have minimal to no contact with the general public or coworkers. So when you're thinking about your workplace and you know, kind of stratifying employees by job exposure risk, that's something else that can help you in thinking about your infectious disease responses. Which of your employees are low risk, medium risk? Do you have any that are more high risk? To be able to think about that. And in workplaces, sometimes it's helpful to break your business apart by zones and thinking about, is there a particular zone in your building where, you know, certain employees are going to be low risk versus medium risk? And if you have your building broken apart by zones, it will also help you in terms of thinking about cleaning, or if there are certain zones that employees may or may not, you know, be high traffic. Or if there's areas that you want to steer employees away from being in, and saying, you know, we want most everybody to stay in a particular area to minimize exposure to other certain parts of your operations. Okay. So exposure, we talk about, you know, employees' exposure risk, that it's most likely going to vary from role to role. Thinking about what things can you do to reduce your employees' exposure risk. You know, it could be gloves and masks. However, we know that right now the healthcare professionals are in dire need of those things. So one of the things we talk about is there the potential of having cleaning supplies at individuals' workstations to be able to, you know, help keep them clean where individuals maybe aren't sharing tools. You know, make sure that you're keeping employees informed on what it is that you're doing to try to help to keep them safe. Okay. You know, if you're using a particular type of HEPA filter, you know, or, you know, cleaning processes or procedures, you know, make sure that you continue to inform them of those types of things that you're doing. You know, we know that employees have worries, right? I'm sure everybody who's listening has worries too about how are, you know, your employees in your business and keeping things going. You know, make sure that you have a way for your employees to ask you questions, and make sure that there's a way for you to get answers back to them. Right now, more than ever, your employees are also needing that leadership and guidance from you, and knowing that you're there to support them and that you guys are all working as one team. Some companies might have an EAP program. It stands for Employee Assistance Program. It usually allows for 6 or so visits with like a mental health professional or a counselor. If you have an EAP program, make sure your employees know that it's there or how to access it. You know, mental health is certainly a concern, just like helping employees maintain physical health right now. Even without it being a stressful time and this pandemic that we have in social distancing, typically 1 in 5 U.S. adults will have some type of mental health crisis like depression, anxiety throughout the year. So we can anticipate that that need is going to be higher right now. Make sure that your employees know what support and resources are out and available in the community in terms of 800 numbers, you know, resource phone numbers, things like that, to be able to help support them to locate resources if they are needing that, you know, counseling or support to be able to help them during this really stressful and difficult time. Okay. Distancing, right? We've all been hearing about distancing and social distancing and limiting the amount of exposure that we have and staying a distance at least 6 feet from individuals. So it might help if you still have employees who are coming into work, have that visual about like what 6 feet looks like. You know, if you have like a dowel or something like that, or even a piece of string that you can cut that's 6 feet, those visuals are so helpful. That lets them know about, you know, if they can see what 6 feet looks like, then they can kind of gauge to make sure that they have that distance. I know, like I said, every manufacturer is a little bit different. For some of you, you might be able to stagger your shifts or adjust your shifts to reduce the number of people who are working or coming in at one time. If you have shifts that typically have some type of an overlap, do you have the potential to reduce each of those by a half hour or an hour? The reason I ask that or suggest that is if you have employees who, if you have a locker room and you have an overlap in shifts, you are then going to have a number of employees all in the same place, and it's going to be really hard for them to follow social distancing in 6 feet if you've got 20 people in the same locker room. So, you know, can you have one shift and 30 minutes earlier or an hour earlier so that individuals can finish up what they need to at their workstation, you know, maybe clean and sanitize their area before they leave, get their belongings from their locker, and then also, you know, that gives them time to exit the building, and then that gives that incoming team the time to come in so that they are not passing each other or sharing that close space at that particular time if they're changing over. If you have employees who need to share lockers, you know, thinking about what are you doing to clean those lockers in between those shifts then, so that that you're minimizing or reducing the chance of transmission of a virus if somebody does have it and they just aren't symptomatic at this point in time. Let's see, so can employees be distanced from one another? Depending again on the type of work that your company does, is there the potential to adjust or move workstations temporarily to have them still be able to do their work but be maybe spaced a little bit further apart as much as possible? You know, we've talked about individuals and employees working remotely. Do you have everybody working remotely who can? For employees who are still in the building, is there a way that you can work to minimize those face-to-face interactions? You know, through technology, can they email or text one another? Do you guys have, you know, their walkie-talkies that they can use and sanitize in between shifts so that employees who are working together, you know, but you can minimize the amount of face-to-face contact that they potentially have. You know, for lunchrooms, right, kind of a high-touch area where a lot of people tend to be, you might need to space those tables apart. You might need to, there might only be able to be space for, depending on the length of your table, there might only be space for 1, maybe 2 people at each of those tables in your lunchroom to help follow those 6 feet distancing guidelines that are being suggested and recommended. Thinking about, you know, essential operations, do you have the staff that you know, what staff do you need to have to carry those out? And do you have employees cross-trained in case one of those potential individuals is out or unavailable for a period of time? Now, to talk about, you know, do you have employees who can job share the work so that you maybe have some individuals who are 2 or 3 days on, and then there are 2 or 3 days off, but then somebody else comes in and does those a couple of days. Again, I know every company is different, and some of these things are just suggestions. They may or may not be something that your company is able to do. You know, if you have a type of business where you have maybe truck drivers who are coming in to pick up and load product, you know, do you have processes in place to be able to minimize their need to come into the building in terms of notify you that they're there? Do you need to limit or restrict their access to the building to not only protect them, but to protect the employees too, in practicing the social distancing? If you have employees who typically think maintenance or other employees who share tools, You know, are you going to have them continue to share tools and disinfect them in between each use? Or are you going to have each employee have their own set of tools to minimize the amount of sharing in between? You know, each tool is different, and I can't say that I know what the cleaning guidelines are or special cleaning procedures that might need to take place to do that. So that's going to be something that your company would need to decide if that's going to work for you. Thinking about some basic prevention measures, right? You know, we know that washing hands is one of the best ways to be able to prevent disease transmission. You know, if soap and running water are not immediately available, you know, can you provide alcohol-based hand sanitizers? We do know they need to be at least 60% alcohol. The alcohol is what is effective in the hand sanitizers to help reduce the virus. So that's the effective ingredient. You know, do you have the ability to have like portable hand washing stations in your facility? Some companies maybe have that ability, some may not. Make sure that if you have the bathrooms and like a cleaning protocol, that there's soap and that there's warm water and that there's paper towels available in the restrooms. You know, if you have the hand sanitizer available, make sure that it's in those high traffic areas so that it's accessible to employees to be able to utilize that. If you have tissues that are out for general use, make sure that you have a garbage can and the sanitizer right there so that there's no barriers preventing individuals from throwing their own tissue away and then sanitizing their hands afterwards. Okay. We talked about, you know, require employees to stay home if they're sick. And that goes back to making sure that employees know what the signs and symptoms are, that they would be required to stay home, and then also making sure they know when they're eligible to come back to work and how long they would need to be out for. You know, one of the things we want to make sure too is that we encourage employees to utilize that respiratory etiquette, right? Covering their coughs, their sneezes, to help minimize that spread. For some individuals, you know, companies might need to reflect on what their policies are in regards to their sick time. You know, if you're a company that has a point system, that's something for each company to evaluate whether or not you are going to keep a point system in place right now or not, because we don't want to penalize individuals for staying home when they are sick, because we definitely don't want them spreading any germs or viruses around. Thinking about what are your cleaning procedures, right? We know that if we can be preventative and have kind of a preventative mindset in place, that hopefully that will also work in helping to spread the virus. What are your cleaning procedures going to be? What areas of your building? And that's where having your building set out by zone can be helpful in thinking about areas that maybe are high traffic that most people are going through. Does that have a different cleaning protocol and timing than what other zones of your building might be? Reflect on what products are you going to be using and following the guidelines for those particular products. What times a day are you going to be cleaning, and what does that cleaning schedule look like? And making sure that you have a checklist that you know that it's being done, and identifying who's responsible for that. Again, I know every company is different, so you might have employees who are double dutying in terms of also helping do some of the cleaning. You might have a special team that does your cleaning. But just thinking about what are those cleaning procedures going to be? How are they going to be? Are they going to be different if you have somebody who's infected versus, you know, still taking a more preventative approach? Okay. So I think visuals are great for team members to be able to have. So I have some different links for you in terms of, you know, hand washing posters, proper etiquette for when you have a cough, the poster about symptoms of COVID-19 that you can put in your workplace, and then just another one on how to be able to stop the spread of germs for you. So thinking about employees, you want to make sure that you're being clear and consistent in terms of what your guidelines and expectations are. Again, make sure that your employees know what the signs are of COVID-19, that they know when they can return to work if they have been sick, that you're consistent in the enforcement of policies, and that employees know what your policies are. And again, you might have to adjust some of your policies for COVID-19 due to just some of the unusual circumstances this has created. And while you may typically ask for a note when somebody's being out of work for an extended period of time, that might be something that you need to consider if you can waive that request for right now, knowing that our healthcare system is already feeling pretty overwhelmed at this point in time. So at this time, I'd like to be able to open it up to see what questions that you guys have as the attendees. All right, so one question I see is if someone starts feeling ill and they've been carrying the virus and been carrying it and been infectious for at least a week, that we're seeing someone starts coughing and sneezing at work one day, it's a separate issue than if they call in. The virus is everywhere the person was the previous week. So I think that's going to be something that you as a team might need to decide. When you have employees who maybe have been traveling or are traveling, are you going to have a form that they fill out to be able to kind of gauge what their risk is or what their exposure has been? I know I've got some family who live in a different state, and their employer was very clear with them, if they leave the state for vacation and they come back, they will automatically have to remain out of work for an additional 2 weeks. Every company is different, but I think what you need to reflect on is, if an employee is sick and they're showing signs and symptoms of COVID-19, what is your responsibility then to maintain the wellness for the rest of your employees? And if it's something where they might need to go home because they might be infecting everybody else. So taking temperatures, yeah, that is definitely a tricky question, and I think something that you might need to consult. One of the things I was reading is that you might need to consult like an attorney and for HR practices in that, because there is some question about whether or not you can take employees' temperatures upon coming into work. So I can do a little bit more looking into that and get back to you on that. Let's see. Can employers rely on local health agencies to follow up with those exposed or infected individuals, or should employers ask their own questions? As an employer, you also have the responsibility to protect your employees. So while the Department of Public Health might have one set of responsibilities, your set of responsibilities is going to be a little bit different. So thinking about what you might need to do to help educate your employees or keep them safe, and what you might need to do for your workplace in order to, if you need to clean it, or do like a deep clean or disinfecting of it. That's going to be a little bit different than the focus that the Department of Public Health might have. Other questions?
April, there's some questions in the
Yep.
chat.
There's some questions in the chat. What if you have a facility an hour and a half to 3 hours away? Is it considered irresponsible if you're transporting product? Is what I see here.
Like the last question, I'm not exactly sure what it is that they're asking. And yeah, we can send a link with the employee posters. Everybody will get a copy of the presentation so that you'll have access to that.
There's also a question, what type of cleaning needs to be done if there is a positive infected employee?
Yeah, so that's going to be something I think, you know, for each workplace to decide what type of cleaning is going to need to be done and in what type of workspaces that employee was in, and what type of chemicals can be used in your particular work area or space, because all manufacturers are different. And so some products that might be able to be used in one particular company may not be something that could be used in another. And I know there are different agencies out there that can do some of those cleanings.
Great.
Let's see. So I can work to create an example of a flow chart and to be able to provide that to those of you who are interested in it or interested in something like that. So kind of that who needs to know, kind of a typical protocol. It may end up being something that's more vague, that indicates that, you know, we've had a positive infection and it was noted on this date, but you're not going to be able to give a lot more information than that. You know, and let's see, so a temp agency. If you have somebody who's indicating that they're feeling sick, you know, again, that's going to be up to your discretion in terms of, you know, kind of weighing out if they end up truly being sick and no action was taken, what's the risk? And that's something that you as a company would need to evaluate. And you're concerned about if they are sick, might there be the potential that other people end up being exposed? See. So
like
different products.
Did you see any other questions? Excuse me, April.
So it's just looking at the ones, your products being made at different shops and you transport it back and forth. You know, I think as long as you're following the protocols that you've set in place and you're not noting, you know, you're not aware of there being any infected individuals and your product isn't contaminated, I think that's what you need to make sure that you're continuing to keep an eye on, and that you have the ability to be able to log or track your product. If you use like some type of a lot number or system like that, being able to track that information so that if something does by chance come up, you know what product was transported when, and if you later on find out that there's a potential exposure, that you're able to kind of trace those things back.
Looks like another question from Jamie about whether or not a company can request or enforce a policy for things such as wearing gloves, masks, touching door handles. Could this be now deemed perhaps part of their quote unquote new uniform to work, which again, Missouri is an employment at will state. I'm sure April, you can go into more about that.
Let's see. So I think one of the things too is, you know, some places you might have, you know, because we know that gloves and masks are really a high need for healthcare workers right now. You know, it might go back to what is your risk exposure. And if you have everybody who's a lower medium exposure employee, thinking about what other things do you have in place to be able to help protect them. You know, if for the touching door handles or keeping them open, some workplaces you may or may not be able to do that depending on what your company is. And if you have have locked entries or things like that, you might have tissues there for them to be able to open the doors, or you might have, it might not be something that can be implemented right now, you know, where kind of like you wave your hand and the door opens and it's a touchless type of system, or like those little footholds that you see on some of the doors where you use your toe to be able to pull the door open. you might have things like that to help minimize the amount of spaces or things that employees are touching, so that it can be kind of touchless as much as possible. Again, if you have those areas that are going to be high touch, where you know that a lot of people are going through there every day, they're touching a lot of things, is it, do you have, sanitizing stations there? Are you going to have employees kind of wipe down their workstations? Are you having like a sanitizer solution, available for them to clean and wipe down workstations? Those are all going to be things that each company is going to need to decide about what it is that you want to do.
It looks like you have answered all the questions. April, thank you so much. And if you all are joining us still and you're still listening and you have any additional questions, you can just send those to me and I'll make sure April gets those. And again, to reiterate, if there's a challenge that you're facing or you would like us to dive deeper into this, it sounds like April is ready and willing to do that and take that on. And again, that is our role here, is to help you address some of those challenges that you're facing and that we're all facing right now. We'll be sure to send you all with a copy of this presentation. Again, if you're interested in learning more or working with April directly on implementing a plan or working on a plan, getting samples of flowcharts, we can make that connection with April or with your area business manager. Tomorrow we will be here at the same time, same place, thanks to Zoom. This time we'll be focusing on business continuity planning, how to weather this storm and others by focusing on resiliency, the ability to see opportunity in adversity, which is what we're all trying to do right now, especially as we're attempting to fill the medical supply gap. On Wednesday, we'll be back here again and there to talk about supplier scouting program and how we can connect you with materials and suppliers in Missouri and throughout the US using our free database. So I think that's it for today. Thank you again. We'll make sure this presentation is on our website. That's the the COVID information site. If you go to MissouriEnterprise.org, scroll down into the blogs and then click on COVID information for manufacturers. Thank you again for joining us this afternoon, and please stay safe. Thank you.